Hi, this is Joyce Pellino Crane. I'm the news director at WestfordCAT. I'm here today with the candidate for State Senate, 1st Middlesex District, Ed Kennedy. Welcome, Ed.
Thank you, Joyce. Thank you very much for having me on.
Happy to have you. So I thought we would just chat a little bit, let people out there in the community know a little bit about you and who you are, where you came from, and what you stand for.
Okay, well, I'm the Democratic nominee for the 1st Middlesex State Senate seat. I grew up in Lowell. I live in Lowell now. I have 2 children who are grown, 2 grandchildren who are 4 and 2 years old. I served on the City Council at 2 different periods of my life. First of all, when I was very young, well, 26 years old is very young. I served for several terms on the City Council back in the 70s and 80s. I then served 2 terms as a Middlesex County Commissioner, and then took a hiatus for about 17, maybe 20 years. And
That's a long hiatus.
Yes, it is, but there were other things that I needed to focus on, so that's what I did. And then in 2011, I ran for City Council again and was elected, and I've been on the City Council ever since. Last year and the year before, I also served as mayor of the city. And Lowell has a Plan E form of government, and so the chief executive of the city is actually the city manager, and the mayor is the ceremonial head, which basically means I was the chairman of the city council, the chairman of the school committee, and also the ceremonial head, in that I was the one that cut ribbons and would give out keys to the city and proclamations and that type of thing.
Big job.
It was a very time-consuming job, yeah, absolutely. But also a very rewarding job. It was, I was really happy to have had that opportunity to do that. Most people that serve on the City Council never get that opportunity. And so I was happy to do it for that 2-year period.
So you were one of the lucky ones.
Yeah.
I do want to point out that you beat out a field of 4 other candidates to become the Democratic nominee for this seat, this senatorial seat.
Yes, we just went through a very competitive primary campaign that mostly stuck to the issues, I think, and so that was good. I thought it was a pretty positive campaign. Mm-hmm. I thought everybody did pretty well in that campaign. Since that time, I've been able to get the endorsement from several of the people who ran. John Drinkwater, for instance, mm-hmm. Bill Martin and Terry Ryan from Westford have all endorsed me going forward. So that's good. But this, the primary was September 4th. So while those guys didn't have to campaign anymore, I've been at it for 2 more months. But election day is next Tuesday. And
your opponent is John McDonald. Just
yes.
wanted to mention he's the Republican candidate.
Mm-hmm.
There's no independent that I'm aware of.
No, there is not.
So we'll see what happens.
Yes.
Today is November 1st, so we've got 5 more days before
right.
the election results come out. So I think early voting is happening as we speak.
Early voting is happening as we speak. I know that the president has been on television saying that the early voting has been off the charts throughout the country, but I'm not so sure that that's true, at least in Lowell. It's been reasonably good, but not off the charts by any means. I don't think it's been as good as it was 2 years ago.
Yes, 2 years ago was that was the big presidential election.
Yes.
So
yeah,
it was a success. We'll see what happens. I thought what we would do today, Ed, is just go into some of the major issues of the day and see where you stand on them.
Sure.
So sort of a lightning round, although you can take your time if you have more to say.
Okay.
But I wanted to start off with the opioid crisis. Where do you stand on this?
The opioid crisis is something that we've been dealing with for about 15 years. And it isn't something that we're doing that well with so far. There's still, well over 2,000 deaths a year in Massachusetts.
The highest numbers are in Middlesex county.
Yes, but part of that is because Middlesex County is roughly a third of the electorate. It's the largest county, one of the largest counties in the United States of America, for that matter. So it would, it makes sense that it would be the highest in terms of the numbers. In Lowell, what we did a few years ago is to create an opioid task force, and that opioid task force has met on a monthly basis. We've met with the District Attorney Ryan several times. She's been very involved. We've had Ed Markey up to talk about the crisis. And Trinity Ambulance provides us with monthly reports because they generally show up if someone has an overdose, if there's an overdose event. And so, but what we've found in Lowell is sometimes we have the same person having 2 overdose events in the same day. So it really is just, and we've made Narcan a lot more available in Lowell.
How so? What are you doing?
Every police cruiser has it. Every fire truck has it. It's available in a lot of other places. We have a line item in the budget now for Narcan, which is different than, you know, I mean, it's really terrible that it has to be that way. But I do think that going forward, this is an issue that really, that the federal government needs to step up with, because I think a lot of this can just be blamed on the pharmaceutical companies and also the distributors of pharmaceuticals. And, you know, that we need some changes there. But I think on a statewide level, which is what the state Senate would be involved in, there are several things that we can do. I think we need to increase education, not just in the schools, but also in the hospitals. When you come in to have a hip replacement or your shoulder fixed or something like that, somebody should sit down with you and just tell you what's involved with the pain medicine that you're going to get afterwards, so that you don't run into trouble. I have a friend that you know, and this is a guy that never had a drug problem until he ended up having an operation like that when he was in his early 60s, and he ended up getting addicted for, and it, you know, he was smart enough to get off, but it took him probably a year before he was able to get off.
Is that right?
Yeah, the average age for males is 37 years old. The average age for females
addiction.
is, yeah, and for females it's 31. So we're not talking about, you know, young kids necessarily or exclusively. We're talking about, it runs the whole gambit. And I think at this point, there's probably almost everybody knows either has a family member or is friendly with the family that's had to deal with the problem.
It is very widespread and very concerning. So, let's move on to health care costs. You've got a hospital in your city.
We have a hospital. We used to have 3 hospitals, but now we have 1 hospital with 2 campuses. It's a community hospital. Health care costs I think are a concern for everybody. And I think that, again, that's probably a federal issue, but the federal government hasn't done anything with it. I have a website at kennedy.org, and on that website you'll find a chart that compares Obamacare to Trump care to single-payer Medicare for all. And if you look at the chart, single-payer Medicare for all ends up doing the best and is the best, I think, for people. On the other hand, you know, we need to pay attention to the expenses. So maybe it's we need a little compromise there, but I'm very interested in trying to get control of prescription drugs and also the deductibles, which are very high in many instances.
Deductibles are getting higher, and then also incentives for physicians. Maybe they're backwards a little bit?
Yes.
Rather than...
Yeah, they are. I mean, the number of opiates that were handed out by doctors, you know, 15 years ago compared to now, I think it was probably, oh boy, it's increased several times over, so that it's just outrageous the number of opiates that have been given out lately in the past couple of years.
And that's still happening today?
It is still happening.
Or is it changing?
No, I think the culture is slowly changing, but you know, physicians are charged really with making sure that their patients are not in pain. But I do think that a lot of times they overprescribe, and I don't know why they end up doing that, but that's something that needs to change. And I think education is really, really important. I know people that have gone in to have their shoulder fixed or something like that have been given the opiates when they leave and haven't taken them just because they're afraid of being addicted.
Right.
But that, the alternative means that those people have had to endure pain that they maybe shouldn't have had to endure.
Right. It's a hard call because there are people out there that are living in pain that possibly couldn't function at all without some help, some painkillers. So,
Right.
So I think physicians are caught in the middle a little bit. But I was also talking about healthcare insurance incentives for physicians that they could maybe be incentivized by doing less instead of doing more.
Yes.
In terms of hospital testing and that sort of thing. Is that something you've looked into at all?
Well, I think that I really think what the Commonwealth needs to do is look into the entire system. I think we have to make the assumption that, at least in the short term, the federal government's not going to address it. And so the state should, as best they can, and try to, and I also think that quality health care is a right that everybody should have. We live in a world, we live in a country and in a state where we have the best hospitals in the world here. There's no reason why people shouldn't get the care that they need. And certainly it should not be that they don't get the care they need because they can't afford it.
Agreed. One thing I'm curious about is if the federal government changes the Obamacare Act and takes away, for instance, coverage for pre-existing conditions, can the state step in, or in Massachusetts, does our health care law remain the same?
Yes, I think that we can do, up to a point, I think that we can do things differently than what the federal government is doing. And I think we do things a little bit differently. But I don't think that we do them as well as we could. I think that the cost of prescription drugs is very high. It doesn't need to be that high. Yeah. A lot of these prescription drugs are developed by people who use our tax dollars to develop those drugs, right. And then after they're developed, they overcharge in some instances. And there's been some that have been in the media where people have just been absolutely outrageous with the amount that they'll end up charging for drugs. I've got a friend who, it's a couple that I know, and the husband has Alzheimer's, and so he was going into a facility, and they were unhappy. The family was unhappy with the facility, and the family happened to have the wherewithal to be able to put him into a private facility, which was going to cost $10,000 a month.
A month.
A month.
That's
and they're able
outrageous.
To afford that, which is good for them. Mm-hmm. But most people can't afford that.
Right.
That's a tremendous amount of money. And so those are types of things that have to change, I think. Healthcare doesn't need to be as expensive as what it is.
So we also have a housing market that's out of control. I don't know, so your area, should you win this senatorial seat, you would be overseeing 7 communities, including the city of Lowell.
6.
6 communities, so it would be Lowell, Westford,
mm-hmm.
Pepperell, Shirley?
Pepperell and Groton, Dunstable and Tingsboro.
Okay. I think it's mixed, maybe, the housing situation. Is it among those communities?
Yes, it is. One of the things that I've noticed this year, and I've been campaigning since the end of March, is that with housing, with economic development, it's different. What Lowell needs and what they consider to be economic development is maybe different than Westford. But that doesn't mean that all towns are the same either. Westford, which I think does a really good job with economic development, would be different than what, say, Dunstable or Groton would think was a good idea for economic development. I think the same thing is true for housing. In Lowell, what drives the housing market, at least the apartment market, is the university. because we've got, we have students that take up a lot of the units, and that puts a strain on demand and drives up the prices. I think that what you find in the towns a lot of times is that, you'll have a family of 3 kids, the kids will grow up, and then they can't afford to live in the same town that they grew up in.
That's right.
And part of that, at least as I see it, is that the middle part of the market just doesn't exist or isn't as big as what it needs to be. So there should be incentives, I think, to build for developers, not to necessarily build, $500,000, $600,000, $700,000, $800,000 homes, but homes that are in that $300,000 and $400,000 range. There aren't enough of those starter homes, if you will.
There are barely any homes under 400,000 in this region, or in this town, and maybe I include Chelmsford in that.
Yeah, and I think there would be a strong market for that, Joyce, both with people that are looking to downsize.
Exactly.
But also people that have finished college and have gotten married and want to live in the community where they grew up, and they just can't afford to right now.
Yeah.
So that's where I see the housing crisis as being. I think that's where the focus should be, on the housing crisis.
But isn't that, so from the developer's point of view, isn't it sort of dicey that, I think those big $800,000 homes are being built because that's where the profit is.
It is where the profit is, but I do think that if somebody were to do a development, a subdivision development that was more modest homes, that they would sell out quick. And when developers are looking at a project like that, the sellout period is also very, very important. Time is money to a developer. So if you can build, let's say, 40 houses and have them sold as soon as they're done, that's better off than if you have to sit on some of those homes, let's say 25% of them, and wait for them to sell and end up with a longer sellout period. So I think that we should be able to provide incentives for developers to be attracted to that niche, that part of the market. And I do think that there is, already built in, just because of the sellout period, there is some incentive to do that anyways.
Very interesting. In this town, and I'm sure probably in Lowell as well, and some of the other towns that your area would cover, mental health among students and school security are the 2 biggest, hottest topics. You have children and grandchildren. I have children. How do you see this problem being solved?
Well, maybe a little differently than some people. I don't think, for instance, that teachers should have guns or that there needs to be firearms in the schools. I think that we need to provide, better locks and security than maybe what we do right now. I think that's one thing, and also there should be protocols in place at every school. And I think that those are important things to do. I know there's, I think Jim Acero has suggested hiring retired police officers
That's
and
right.
putting them in the schools, which I think is a great idea. And that's certainly something that I would support.
And you're referring to State Representative Jim Acero,
Yes.
who represents Westford, Littleton, and
Yes.
precincts 5, 7, and 8 in Chelmsford.
Yes.
Yes, that has been called for and he's worked with the police chief in Westford, Tom McEnany, to see if that could get done.
Yeah.
And it looks like it was a success. It's a successful endeavor.
I think it's a great idea, and I think that there were probably a lot of retired police officers that would be attracted to that type of part-time employment just during the school year and to be in the schools. It's a relatively short day for a retired police officer compared to what they're used to.
Right.
So I think that's a real good idea. I think another initiative that Representative Acero has suggested is that there be a commission that just look at that. And I also think that the MSBA should probably make money available for better locks and security systems in schools for communities that feel that they need that and that request that kind of money.
So money is the issue, though. I don't know if you're aware, but at town meeting in Westford, voters approved a sum of $200,000 just to pay consultants to tell us what we don't know.
Yeah.
And that's not to do the work. So it's a costly endeavor.
It can be a costly endeavor, absolutely, but I also think it's worthwhile. It's worthwhile just to provide peace of mind for parents who, as the incidents grow in number, become more and more concerned when you send your children to school. Is everything going to be okay on that day? Because I'm sure that every place where there's been an incident like that, when those people sent their children off that day, they never thought in their wildest dreams that there was going to be a problem during the day.
No, and you're absolutely right. It's terrifying for any parent at this point. So along those lines of mental health issues and stress regarding education, school security, there's also student debt.
Yes.
Do you have any position on this $1 trillion of student debt that's out there?
Yeah, absolutely. And that's been, I've included that as one of the issues in my campaign. I think student loan debt has a substantial negative impact on the Massachusetts economy. You've got a lot of people. We're at a point now in Massachusetts, there's a recent study that was done that indicates that 45% of the people that have student loan debt now in Massachusetts are over 45 years old. Many people, or many households have 2 generations of student loan debt. So you've got parents that are still paying off theirs, and then their children are incurring debt as well. And what it means is that because you've got that loan debt, it means that young people are waiting longer to get married, longer to have children, longer before they can buy a home, because that loan doesn't go away. And when you go and look for financing in order to buy a house, it's a factor. It's definitely a factor.
So it eats into what they're capable of borrowing, I guess.
Yes. So and this, those are national loans. So once again, it's I consider that to be a national problem that really deserves a national solution, but it hasn't come. Yet. But I do think that in the Commonwealth, what I would be interested in doing is providing incentives for employers, so that when you hire a new employee, someone that would come in from college and that would have that kind of debt, you'd pay down some of that debt as part of the package that you get when you begin employment with that company. And I think that would be, that and probably other creative ways would help to reduce that. But there's no question that it's a problem that needs to be addressed, and it's a problem that has, even if you don't have student loan debt, you may say to yourself, well, what do I care, because I don't have I don't have any debt like that. But it still impacts all of us because it impacts the economy in general.
Exactly. It's a great idea to have an employer come in and work things out with the new employee. I like that idea. The issue of immigration, you come from a city of immigrants. What is your position on allowing people to come into this country that are from other countries?
Well, recently there is a bill that passed the Senate this year and did not pass the House, but I think it will probably be reintroduced, called the Safe Communities Act. And the Safe Communities Act, I think, is something that I could support. The Safe Communities Act is a compromise position, and it's something that's been unanimously endorsed by the Massachusetts Police Chiefs Association. And basically what it would mean is, right now, because of an SJ decision from last July, there is nothing that allows, in Massachusetts law, that allows for either local or state law enforcement officers to detain illegal immigrants. It's just not allowed according to the law, according to the Constitution. This bill would change that around a little bit so that if there were, and that's even for if there's even if they're suspected of criminal conduct, they still cannot be detained. So this bill, which was proposed by State Senator Jamie Eldridge, would change that and would have it be that there would be a time where if somebody committed a violent crime, they could be detained for a certain period of time. In Lowell, and I'm sure it's like this in every community, we try to put as many police officers on the street as we can. When I first came onto the city council several years ago, public safety was a big issue. And there was, we were having trouble with crime in the neighborhoods and in the downtown area. And so that's what we did, was we beefed up the police force to the extent that we could afford. And it's made a big difference. It no longer is a big issue. But it's also something that it won't be a big issue as long as you stay vigilant about it. And so we would not be able to afford in Lowell to have police officers just chasing immigrants for ICE, because those are people who are supposed to be protecting us. And so I do think that the Safe Communities Act proposed by Senator Eldridge makes a lot of sense. And I think that because of the SJC decision from last July, the way it is now is that there is no protection for illegal immigrants who have a criminal background.
Very interesting. I think you have a different perspective coming from the city of Lowell, which I didn't ask you this, but you grew up in Lowell.
Yes.
So I just want to take a little side tour and hear a little bit about what it was like. We only have a couple of minutes left.
Well, it was good. I mean, I grew up in Lowell. I grew up in Belvedere, the Belvedere section of Lowell. I went to a parochial school. I went to Lowell High School. And it was good. I mean, I had a regular, I had 3 siblings that grew up with me. We were all close in age. And, I had a paper route, and I had, and played baseball and so forth, and like everybody else, I guess. And I, was a happy childhood. I was pretty happy with it. So it was good, and here I am today. And when my kids were born, I tried to provide them with the same type of environment at home that I had, and I think they are now doing the same for my grandchildren.
And are they nearby?
My daughter, who is the mother of both of the grandchildren, lives in Chelmsford, and my son lives in Lowell.
So you've got them close near to
Yes.
you. That's very fortunate.
I am very fortunate. I've got a cousin who lives in Westford, and both of her kids are on the West Coast. So I am fortunate to have them be so close. And I'm able to see the grandchildren on a regular basis. And actually, I mind the grandchildren. I'm with them all by myself for 2 mornings a week, and that's really
good for you.
Yeah, and that's really that's a rich time for me. I have a great time, and it allows me to act like I'm 4. So
that's terrific. Well, we are just about out of time, so I'm going to say thank you for coming today.
Thank you very much for having me on.
I was thrilled to have you come.
Thank you.
For WestfordCAT News, this is Joyce Pellino Crane. See you around town.